Nurse Paul, I'm concerned about Mr. George's recent echocardiogram. The ejection fraction has decreased significantly. We need to discuss a more aggressive treatment plan.
I understand, Dr. Mihira. His symptoms have been worsening, and he's been experiencing more fatigue.
We should consider increasing his beta blocker dosage. It can help improve heart function and reduce symptoms.
I'll inform the patient and monitor his response to the increased dosage. Should we also adjust his diuretic?
Let's reassess his fluid status and adjust the diuretic accordingly. We want to manage his congestive heart failure symptoms while avoiding excessive fluid retention.
I'll also ensure he's adhering to his sodium-restricted diet and limiting fluid intake.
That's important. We should also discuss the possibility of a cardiac rehabilitation program. It can help improve his overall heart health and reduce symptoms.
I'll schedule a consultation with a cardiac rehabilitation team, Dr. Mihira. Mihira, I'm so sorry to hear you're dealing with an ear infection. The pain and discomfort can be really draining. Let's focus on ways you can nurture yourself at home and find some relief. The most important goal is to support your body's healing while preventing any further irritation to the sensitive ear canal. First, it's crucial to keep the infected ear completely dry. You can do this by gently placing a piece of cotton wool coated with petroleum jelly in the outer ear during showers. Avoid swimming. Please resist any urge to poke or clean inside the ear with cotton buds or other objects, as this can push infection deeper and damage the delicate skin. Allowing yourself extra rest is a powerful tool, as it helps your immune system focus on recovery. For managing the pain and any fever, you can consider over-the-counter options like paracetamol or ibuprofen, carefully following the dosage instructions on the packet. Some simple, non-medicated ear drops from the pharmacy may also provide soothing relief for mild infections, but it's always best to check with a pharmacist first to ensure they are appropriate for your specific situation and safe for your eardrum. Remember, if the pain becomes severe, you develop a high fever, or your hearing is affected, please do reach out to a doctor for further guidance.